Welcome, my name is Peter Strong and I offer online therapy via Skype. I offer Skype counseling therapy using mindfulness-based techniques to help you better manage anxiety and depression. So mindfulness-based therapy is extremely effective because it teaches you practical methods that you can employ yourself between sessions and develop the necessary skills to manage difficult emotions like anxiety and depression or addiction. So mindfulness therapy is about giving you practical tools. One of the most practical tools that we will explore during our sessions together is mindfulness meditation. So I teach mindfulness meditation, but specifically for the purpose of healing emotional suffering. So during this kind of mindfulness meditation, you learn how to meditate on your emotions. That means being able to develop a conscious and non-reactive relationship with your emotions, with your anxiety, with your depression, with your fear, with your obsession, whatever it might be. The most important thing you can do is learn to develop a conscious and non-reactive relationship with these emotions. Most of us have not learned this skill, and the result is that when anxiety or depression or obsessive emotions get triggered, we simply become overwhelmed by them. We become consumed by them. This is called reactive identification. And when we become identified with our emotional reactions, then they basically control us. We lose that conscious perspective. For example, you will have experienced what happens with anger. If you get very angry, you lose perspective. You essentially lose consciousness, and you become controlled by the anger. So during mindfulness training, we learn how to sit with our emotions, meditate on them, and develop a non-reactive conscious awareness. We call this equanimity, and it's a very powerful skill. And it takes some training, but if you train deliberately and you know what you're doing and you have some good guidance, you can very quickly get to a place where you can observe your emotions without becoming overwhelmed by them. This now puts you in a position where you can help change those emotions. So the first most important thing that we're doing here is not feeding the emotions. If you can sit with them without reacting, you stop feeding them. And if you stop feeding any emotional reaction, that reaction will begin to subside by itself. And so essentially you're reinforcing the neural pathways that allow emotions to resolve themselves by continually sitting with your emotions and not reacting. The second part of our mindfulness work is about healing those emotions, healing the underlying emotional pain, whether that's fear or depression or guilt or anger or stress, whatever it might be. We work to heal that, and that is the response of compassion, which is a very important part of mindfulness therapy and mindfulness training. It's not sufficient to just see emotional suffering. We must respond to it in a way that promotes its healing. This is the definition of compassion. Now, just establishing that relationship will greatly facilitate healing by not feeding the reactivity. It also facilitates healing by establishing this very important relationship in the mind that we call the true self, little self alliance. So the little self is the emotion, the anxiety, the depression, whatever it might be. That's the content of mind. It's conditioned, it's reactive, and it is stuck, essentially, not able to heal itself, rather like a child. The true self is that part of your being that is able to be aware of the little self. So when you can observe your emotions clearly without reacting, then that which observes the emotions is your true self. Now, the true self by its nature is a less reactive. In fact, it does not react at all. It is just completely present in a friendly and compassionate way. But this is exactly what the little self needs. Your internal fear needs to connect to that part of you, your true self, that is not afraid. This is what helps it heal, in the same way that a parent can help a child overcome its fear just by its presence. When there's conscious and loving presence, that will heal the fear of the child. So this internal alliance, this internal relationship becomes fragmented when we suffer emotionally. So when we are suffering from anxiety, the anxiety emotions become isolated, cut off from our true self. The same for depression. It becomes isolated, contracted and cut off from true self. And we feel that. Anxiety feels very claustrophobic, very alone, very fearful. Depression has the same kind of qualities. We feel very isolated, disconnected. So building this alliance between true self and little self is a major healing factor in itself. But we can also help the emotion heal by interacting with it, with compassion. And this often involves working with the imagery of the emotion. So all emotions like anxiety and depression or compulsion or stress or guilt, whatever it might be, it has certain specific internal psychological imagery that supports that emotion. And that imagery is vital. It's what actually causes the emotion, and it's what gets triggered in the mind that then causes the emotion to take form. So, for example, anger is very commonly associated with the color red, and its imagery has that characteristic color of red, and it's often very hot. So it has heat as a feature of its imagery. and other features as well. Depression, associated with the color black. And you can find all kinds of different imagery in your own experience, if you look, that is associated with your emotions, the way you feel. Now, seeing this imagery is very, very useful, because once you see the imagery, which is formed out of habit, is reactive, you can change that imagery. You can help the imagery change. And this is the primary mechanism through which emotions change themselves and heal. When emotions heal, they do so by changing their imagery. They become smaller, the color becomes less intense, and so on. So we can facilitate that, we can speed up that process. So this is all part of the compassionate response of mindfulness, is working with the emotional imagery to help the emotion heal and to let go of its emotional suffering. So this is a brief outline of mindfulness therapy that I offer during Skype counseling therapy sessions. If you would like to learn more, contact me. If you would like to schedule a trial session, contact me. I see people through Skype because I find that to be the most effective way of establishing a good line of communication. It's important that we see each other. That makes the communication more effective. The mindfulness approach is very, very effective. I've helped hundreds of people over the last 10 years or so using these methods. And I tell all my clients, you should expect to see significant changes within the first 3 to 4 sessions. This is substantially different than conventional talk therapy. We're not spending our time talking about our feelings. Rather, we are examining how they work and how we can change those feelings, how we can help them heal directly by working with our relationship to our emotions and by working with the imagery of our emotions. So if this interests you, contact me and let's schedule a Skype therapy session. Thank you.